Appreciate you all making some time to be here. I wish we were talking about something less scary and overwhelming, but I'm glad that we can be together and hopefully we'll help answer some questions, share some resources. I am going to try to move relatively quickly through slides so that we have lots of time for questions and discussion because I know it's been an incredibly overwhelming year, months, couple of weeks here, and information feels like it's changing every day. So we are going to do our best to bring some up-to-date information on what's happening with SNAP. And then again, we'll have lots of time for questions. Just to quickly introduce myself, because I see some new faces, my name is Nora Bent, and I'm the Director of Government Affairs and Strategic Partnerships here at the ARC of Massachusetts. And I'm joined by many colleagues who will speak at different parts of the presentation today. But I'm going to pull up my slides and we'll go ahead and get started. All right. And as I'm going through, if anyone has questions, feel free to throw them in the chat and I'll try to take them as they come. And then again, we will have lots of time at the end for questions and discussion. So really wish it was under better circumstances, but glad to be here with all of you today talking about SNAP, the current shutdown and the connection to our community. And again, want to provide some clarity as best we can and some resources about what happens next. First, want to start off by just shouting out the sponsors and supporters that make these educational webinars possible, which is more important than ever in these days when we need to bring clarity and information in this really overwhelming time. So I'm sure folks are somewhat familiar with SNAP, but I want to just kind of level set and share some information about the importance of this program. SNAP is the country's largest anti-hunger program. About 42 million Americans, which is 1 in 8 people, rely on SNAP. So really massive in size and scale. And the amount that an individual gets or a family gets for their SNAP benefits is based on their level of income and need. On average, it's around $190 a month. Some people get more, some people get less, but that is sort of the average that we talk about. And SNAP is funded by the federal U.S. Department of Agriculture and is administered by states. So the money comes from the federal government, and states are responsible for sending it out to people's EBT cards so that they have the access to the nutritious and consistent access to food in every month. I think it's really important to point out what a unique moment this is in this current government shutdown, where we are seeing SNAP being kind of benefits not being sent out for November. In previous government shutdowns, SNAP has always been fully funded. So this is not the norm. This is not a typical kind of result of a government shutdown. This was a choice that was made by the administration. And I think it's really important to highlight that this is unique and we're kind of all navigating this moment together. We could truly be here all day talking about SNAP and talking about this moment. So I'm really just trying to give the highest level overview just to kind of center our conversation. Specific to Massachusetts, there are about 1 million people that rely on SNAP in our state. And 31% of that million figure are people with disabilities, 32% are children, 26% are older adults. So this is really a program that targets some of the most marginalized in our communities. And every month, the state gets about $200 million in benefits that they send out. That is a lot of money every month, right? So it speaks to both the amount of support that's sent out to people and how challenging it is for states to now fill in this gap that is being left by the federal government as these benefits are not being sent out. So we're going to talk a little bit more about that later. I want to just call attention to the photo on your screen as some uplifting news. We attended, I think last week, a rally with hundreds of people at the State House about protecting SNAP, the importance of SNAP. And it was one of those moments where you really saw the community come together to talk about these issues. So even though this is such a scary moment, it was uplifting for us and hopefully uplifting to share that There is so much advocacy power in this moment, and so many different organizations and groups are calling attention to SNAP and talking about the importance of these benefits and the consequences of not having them funded. So hopefully that's some good news in this moment. Um, Again, we could be here all day talking about just the last couple of weeks. So wanted to just really quickly go through the kind of high level of what's happened in the last month. A lot of these pieces you've probably seen, but I think it's helpful to talk about them together. So as folks probably know, October 1st began the government shutdown, which happens when there's an inability to reach agreement on a federal budget. And now officially, this is the longest government shutdown in history, still going on November 6th. Later in the month of October, the USDA, which again administers and funds the program, officially announced that SNAP benefits would not be issued for the month of November. Immediately the following day, which was also the day we were at that rally, 20 plus states led by Massachusetts Attorney General Andrea Campbell filed a lawsuit against the Trump administration for essentially unlawfully ending SNAP benefits for November. A few days later, a court mandated that USDA was required to fund SNAP benefits for the month of November using a contingency fund. So there's this emergency fund within the USDA to be used in moments like this when there is a gap in SNAP benefits. Importantly, the fund does not have enough money in it to cover 100% of benefits for the entire month of November. So following that court case, the USDA announced that it would partially fund at 50% SNAP benefits for the month of November. So that's kind of where we thought we were on Monday of this week. Some reprieve, not enough, right? We knew that there would still be a benefits gap for the month of November. And then on November 4th, just earlier this week, the president wrote on the Truth Social social media platform that benefits would only be released once the government shutdown ended. I think it's really important to note that no official communication has gone out from the USDA to states about the benefits not being released. So our assumption is that the benefits, as we thought, will still be funded at that 50% level for November. And until we see something with more clarity than a tweet, that is our assumption. It is obviously deeply concerning that this statement was put out, but I don't want people to panic that benefits are not going to come out. It does take time. We're hearing probably next week this 50% amount will be on people's cards. And obviously, if anything else changes, we will let folks know as soon as we can. I do want to say that this roller coaster we've been on for the last month, the very real stress and anxiety that creates, I think is really important to highlight. The amount of confusion and lack of clarity that has happened in the last month, that takes a toll on all of us, on everyone in our community. So just want to acknowledge that, and we're feeling it. We know you're feeling it, and we really want to be here to be a good resource and help bring the clarity as best we can. Okay. I want to highlight that even pre-government shutdown and pre the month of October, the SNAP program was facing really significant threats. I know folks have probably heard us talk a lot about the big ugly bill that was signed into law in July, which made significant cuts to Medicaid, the largest in the program's history. The law also makes really significant cuts to SNAP to the tune of about $200 billion over 10 years. So these are more kind of final changes, aside from the government shutdown, looking at policy changes that will limit eligibility and participation. We've heard a lot about work requirements and generally shifting greater cost responsibility for this program to states. So this is kind of a separate piece from the government shutdown, but presents a really kind of existential threat to SNAP. And I think, the amount of attention on SNAP in the last month has hopefully raised some alarm bells about these broader policy changes, but we have to be really focused on these as well, assuming that the shutdown ends at some point and benefits are back out, that doesn't negate these broader $200 billion changes over the next decade. So if it's another plug to be engaged in the advocacy on this work too, moving forward. Okay. Specific to this community, I mentioned earlier that 31% of people in Massachusetts and nationally who rely on SNAP are people with disabilities. That's 4 million people nationwide. 4 million people with disabilities rely on SNAP. And we know that people with disabilities experience higher rates of food insecurity. And when you layer on the rising food costs that so many of us are feeling, housing unaffordability, employment challenges, medical complexity, all of these factors really exacerbate the impact of ending SNAP for this community in particular. So, it's about a third of folks on SNAP are people with disabilities, but there are all these other overlapping challenges that are really important to highlight and help raise awareness about why this is so critical and devastating. I think we sometimes also forget that group homes, residential services also rely on SNAP benefits for their participants. And I am going to turn it over to Sophie Hansen, who has agreed to join us today, Director of Government Relations and External Affairs at VinFen, one of our partners, who's going to talk a little bit more in detail about this component. So Sophie, take it away.
Thanks, Nora. I really appreciate it. Hi, everybody. I'm going to just level set really quickly. And then, of course, if people have questions, I'm sure we'll have time at the end. So like Nora stated, many state contracted programs like VinFen, meaning that we contract directly with the Department of Developmental Services as well as the Department of Mental Health. We have individuals who are eligible for SNAP benefits. So we will then help people apply for those SNAP benefits. Once they're approved for SNAP, individuals can either choose to make themselves or organizations like VinFen the beneficiary of those benefits, meaning who receives the money from the government to spend on food on their EBT card. So if they name VinFen as the beneficiary, that means that we will then access the monthly monetary amounts that the government gives for those individuals, and then we will use that money for the individuals. So in the case of group homes, we would use the money that they collect through SNAP to stock the pantry, fridge in the group home, and work with them about what the individual wants to buy, and all of those things. And then if they name themselves a beneficiary and they live in the group home, we might assist with either making the shopping list, going with them to the grocery store. Obviously, this is really dependent on the person and their situation in terms of how much guidance or support they might need. So it's very individual. So, at this point, a lot of programs, I wouldn't say like we're eating the cost, but we are certainly working to support individuals with our group homes who are not currently receiving the SNAP benefits to make sure that everything is stocked and people can be fed.
Thanks, Sophie. I think that's such an important kind of bigger scale systemic tie-in to this issue. And similar we hear from the 17 ARC chapters that provide services across the state that, this is a really significant portion of their food budget and really has some pretty severe implications. So appreciate you shining a light on that. And I know you're going to stick around. So if folks have more questions, they can ask them later. All right, and with that, I'm going to turn it over to Amelia, who's our Government Affairs Associate, who's going to talk a little bit more about the impact on our community and some other Massachusetts-specific work.
Hi, everyone. So we really want to highlight that these harmful cuts are going to directly affect real individuals in this community. So the ARC of Massachusetts has had an ongoing survey, which is allowing community members to share how the cuts may affect them and what that will mean. Many respondents have shared that they're fearful about how cutting SNAP will challenge them. One person has said, we won't be able to afford food with SNAP cuts. These are real people in our community, and these are their real responses. And then Massachusetts has been a strong leader in the response to the USDA's announcement that SNAP will end in November. On October 28th, as Nora has mentioned, The Massachusetts Attorney General, Andrea Campbell, helped lead the charge in the same lawsuit that we discussed, which requires the USDA to continue to use contingency funds to partially fund SNAP for the month of November. As you now know, the courts mandated this for the USDA, but there's still some uncertainty about the dispersal of benefits. Additionally, our Governor, Maura Healey, has announced that the state will advance $4 million for food banks this month.
Thanks, Amelia. And I think just following up on that point, we talked earlier about how Massachusetts gets over $200 million a month for SNAP benefits. 4 million is not going to fill that gap. And we know that we cannot wave a magic wand and just create that $200 million for November and for future months if it comes to that. So we acknowledge the very challenging position that this puts states in, to be kind of making ends meet, trying to make something work when it's really the federal government that's abdicating the responsibility here from this administration. So we have been working really closely with other advocacy partners across the state to really encourage the state to think creatively in this moment about what can be done. It's SNAP today, but what is it tomorrow? And as we again get into the next 10 years, the next decade of seeing cuts from the reconciliation bill at the federal level, really encouraging the state to be creative and think outside the box in this moment. Okay. So what do we do, right? All of that is very overwhelming and upsetting. And again, we want to hear from you and hear your questions in a moment, but wanted to share some resources, and you will get these slides after. So we'll follow up later today or tomorrow with this information. But the ARC is currently working on an action alert to our congressional representatives about the importance of reversing the SNAP cuts, both from the shutdown and from what the reconciliation bill included earlier this summer. So encourage you to complete that action alert if you haven't already, and then share it really broadly. If you are in immediate need or kind of looking down the line, thinking about your food security, Project Bread has an incredible food source hotline. The number is here, and they are able to help connect you with resources. We've also put together a list of resources by geographic area, so that is linked for your reference. And then if you're interested in helping out, we are trying to do our small part here, and we're doing a food drive at our office. Our address is there, the hours we're accepting donations, so please do come by. Many other community partners are doing the same, so I encourage you to think about the nonprofits and faith organizations and community centers in your community that are doing similar work. So I'll stop sharing in a moment. I'm happy to take questions or just hear what's on your mind. My email address is here if you need more information or need support. And then we also are going to ask you to do a survey to give us some feedback on this webinar, future topics you'd like to see. And again, really appreciate everyone being here, and happy to open it up for questions. I'll stop sharing so we can see each other. Feel free to either put your question in the chat or raise your hand and we can call on folks. While we're waiting, I see one other a comment in the chat about WIC and heating assistance, which are also being affected. Absolutely. I think it is this kind of compounding effect of all of these cuts happening simultaneously and the financial stress and anxiety that creates.
Nora, I just would like to jump in real quick to just thank everyone, but thank you, Nora and Amelia, for pulling this together. I think when things come up quickly like this, we're going to continue to try to gather as much information as possible and give you as much resources as possible. But I also just wanted to thank all the folks who have brought some non-perishable food by. It's been wonderful to see that pile grow in the front of the ARC and to connect with folks who are nearby, and it makes sense to drop by the ARC. So thank you, everybody. I see you have another question though.
Yeah, I see two questions in the chat. One, is there any truth to the headlines that SNAP will be funded by sending checks to families? I haven't heard that specifically. I feel like anything could be true. Who knows what has happened? Um, my understanding is that it will be through those EBT cards that folks already have. And again, what we've been hearing is that it's hopefully early next week. I think there was a delay in getting them out because of the court order and some time for that to process, and just the mechanics of getting funds from this contingency fund to states to then send out to people's cards. I do believe that there are some nonprofits that are also thinking about grocery store gift cards and other creative ways of getting support to people. So that would be a great Project Bread food source hotline question if that is of interest to anybody. And similarly, the other question I see in the chat, I'm concerned about those who are homebound. Do some of the food bank or pantry resources offer any delivery services? I think they do, and I think that would also be another food source hotline question specific to geographic areas so that they could connect you with or the folks you're thinking about to delivery services in their specific community. And I see people putting in specific ideas in the chat of food banks that do those services, which is really great. Any other questions? I know it's incredibly overwhelming and hard to even know where to start, but okay. Well, thank you all so much for being here. We will share out the recording and the slides and those resources. I encourage you to share them widely. We're all navigating this together and figuring it out together. So I encourage you to reach out with questions or other concerns you're hearing. Thanks so much for being here. Bye, everyone.